In case you have forgotten, I was thanking the the organizing committee for having allowed me to present on acne emerging insights. Now, the main thing that I want us to do is generally to be able to look at what acne is in terms of what we know. That is what I'll be talking about in introduction. The elements of acne pathogenesis so that we understand what actually is going on in terms of acne development and future perspectives in drugs targeting elements of pathogenesis. Now, acne generally, we know it's very prevalent. And I think as other speakers will be speaking, you'll be able to understand that. And it is an inflammatory disease. We assume that it is simple. It is not that simple. It is multifactorial and very complex in the way acne lesions develop. We tend to know that acne has three main actors: the hyperseborrhea, abnormal follicular keratinization, and Cutibacterium acnes, proliferation within the pilosebaceous unit. Now, as we look at this, there are many things that are going to happen. Now, I've decided to break it up by calling it elements which are playing different roles in terms of acne development. Let us start with the sebaceous gland. Remember, acne, we talk about the pilosebaceous unit. Now, the sebaceous gland is a holocrine gland. If you remember from your physiology, the gland cells are the ones which are going to be disintegrated for you to be able to get the sebum production. It is considered to be the brain of the skin. Now, you know, we think sebum, as Dr. was presenting, remember he said all it does is to be able to moisturize the skin. But I hope as we'll go on, you'll be able to know that the sebaceous gland is actually the brain and quite a number of things are going on there. And this is where now we are able to look into the new insight into the pathogenesis, which gives us the treatment of sebaceous gland associated diseases. It is very hormone sensitive. So you'll be able to see quite a number of things whereby now we used to talk about diet not playing a role. You may now understand why diet plays a role. When we look at the sebaceous gland, it responds to neuropeptides. And these neuropeptides, as you think of them, think of the hypothalamic, hypothalamic, pituitary, adrenal axis. There are many things that are going to happen in that process. So these neuropeptides, even when it comes to the nerves themselves, they are releasing the peptides which are going to affect the inflammatory cytokines within the sebaceous cells, the proliferation, the differentiation, the lipogenesis, and androgen metabolism within the sebocytes. This means there are quite a number of things going on, which as we manage acne, we should be thinking in terms of treatment. We have endopeptides which break down these neuropeptides, and it could be one of the ways that as they're coming up with new treatments, they can be able to handle acne management so that we can be able to stop it at a much earlier time. Now, I talked of the axis. Neuropeptides, we have the neuroendocrines. Now you have the corticotrophin releasing hormone. This one is the one which induces the neurolipids within the sebocytes. Remember, they're going to increase, they're going to break down and cause sebum. So the corticotrophin releasing hormone, the sebocytes have receptors for this, and this could be an area where now it is leading to the effect of acne coming up. We have testosterone antagonizing the corticotrophin releasing hormone. In terms of treatment, we can be able to address it and start handling that to be able to come up with treatments. The growth hormone, let's talk of the adolescents. The growth hormone is increased. It is going to enhance the release of these inflammatory interleukins. Interleukin 6 and 8 are the main ones which are being looked at. There is the pro-opiomelanocortin, which has a role in terms of neuromodulator in controlling sebum because the melanocortin receptors are present within the sebocytes. As we go on, we see that this sebaceous gland is also involved in innate immunity. We only used to think of the Langerhans cells, the melanocytes, but the sebocytes are also involved in terms of innate immunity. So the pilosebaceous gland now as a whole is an immunocompetent organ. Now we find that keratinocytes and sebocytes are able to recognize abnormal lipids that are presented to them, and also the pathogens. Now, that means when you're talking of bacteria, this is what is going to happen in terms of trying to cause the development of acne. We also have the sebocytes expressing these receptors for toll-like receptors, which are now able to make an immune response and cause inflammation. Now, we also have the Cutibacterium acnes, and altered lipid content are thought to activate keratinocytes and sebocytes, followed by release of inflammatory cells. So as we go on, we see that within the sebum gland, there's quite a number of things that are going on related to what is attached to acne. Now, when it comes to the sebaceous glands, we always used to assume that it is the intrafollicular epidermal cells that are, it is the follicular cells that are able to produce the stems, the cells for the sebocytes. But it has been found that the sebocytes themselves are able to produce both follicular and sebocyte as germ cells, as stem cells. We have talked of many responses within the sebaceous glands, and this is because it has receptors. I used to say cells communicate to each other. So having receptors means that you can be able to communicate and do certain responses. And all these receptors are put there, which you shall see as we talk about hormones, where the attachment is, and it's going to make the sebocytes start responding. These are the ones, the receptors are the ones which now we should start looking at in terms of when it comes to treatment. And it will make you understand why now we have to talk about diet. I think somebody will be talking of phototherapy. What is it doing? It is causing immunomodulation. Those are the things that we have to start thinking of. The presence of acetylcholine and nicotinic activity can also promote fundibular hyperactivity and follicular plugging, thus implicating nicotine uptake by smoking in acne. So when it comes to smoking, you find that the activities now, these ones are related to acetylcholine and nicotinic activities within these sebocytes. Now, of these receptors, I have picked this one particularly to be able to show you that there are receptors which will be activated by stress, and those ones which can be activated by diet. And this is important in terms of now trying to know, as you explain to your patients, why is it that stress can cause it? And while we are talking about stress, you'll find that when it comes, I think I'll talk about it later on. Hormones are also playing an important aspect in terms of pathogenesis of acne. Now, when it comes to acne, people have assumed that if you have high androgen levels, it means that the acne is going to be worse. But they have found this not to be true, because the androgen, both in patients with acne and those ones who don't have acne, it has been found that generally the amount of androgen is the same. It is only at the local levels where either the sebocyte cells are able to convert the androgen into, they're able to locally produce androgens in the skin, or the expression of these receptors within the sebocytes is very high. And that's where the difference is going to be in terms of the hormones. I had talked of the hypothalamic pituitary adrenal axis. This is where now the growth hormone comes in, and the endocannabinoids also act on it. These are systems which are important because the endocannabinoids have been found to have receptors within the sebocytes. And this is one of the new things, and it is related to cannabis. Now, this is where this system is able to control stress. And it is the normal way in which we are able to control ourselves. Even they're relating it to hypertension. So in the skin, they found that they have receptors, these CB receptors, which are able to detect, and this could be one of the areas whereby we can be able to control the stress aspect in terms of development of acne. The other thing is in the way there is hyperkeratinization within the follicles. Now, the pathogenesis is still not very clear. And I think as we keep on knowing, we might be able to stop acne development by being able to know how to handle this. Interleukin-1A has been associated with the induction of this hyperkeratinization. There is one thing that we keep on relating to eczema, and we may not relate it to acne, and this is filaggrin. And this one has been found that it is increased in fundibular keratinocytes, and it has been associated with the disorder in terminal differentiations of these cells, and may be involved in terms of patients developing cystic acne. Now, dihydrotestosterone may act also on the infundibula of the keratinocytes, and this could be also a point whereby we can be able to use in terms of treatment. Corynebacteria acne has been implicated also in the formation of comedones, and this is one of the areas where they're thinking of trying to stop acne if they're able to handle this at that point. Now, when it comes to the bacteria, I think the microenvironment in terms of bacteria on the skin, they have looked at it and they have found that despite C. acnes being present on the skin surface at low levels, it is the dominant resident in the normal flora for species within the sebaceous follicles. Acne vulgaris is not the result of a greater proliferation of the C. acne, but it seems as if there is a strain whereby which is thought to be the one which triggers C. acne. And because of this, they're thinking of probiotics so that they can be able to only remove the stain of C. acne, which causes and promotes acne within these patients. Staphylococcal epididymis is known to, and C. acne interact together, although the role of Staphylococcal epididymis is poorly understood, but is known to inhibit the effects of C. acne, which is the reason why they're coming up with this treatment in terms of probiotics. Now, there was a film which Dr. Imalinga talked about in terms of staphylococcal aureus in the skin in patients with eczema, but also the same happens within the acne patients. And we find that C. acne is able to create a biofilm made out of cellular polysaccharides, which increase the adhesion of the bacteria to the follicular wall, and also helps in resistance to antimicrobial. And when it does this, as the process of keratinization continues and this exfoliation of this, it ends up plugging. And once it is plugged, it creates an environment which is anoxic, meaning that there is less oxygen, and this is very good for the C. acne to be able to proliferate. And it has been suggested that this C. acne modulates the differentiation of these keratinocytes. As we move on to nutrition, remember there are receptors which we said are within the sebocytes. We have found that daily products contain 5-alpha reductase steroid hormones and other steroid precursors of dihydrotestosterone that drive the sebaceous gland function. Now, drinking milk has been found to increase the insulin growth hormone 1, and through a disproportionate elevation in blood sugars and serum insulin levels. I think all of us are aware that vitamin A is needed for the normal follicular function and is often deficient in teenagers. And they sometimes start thinking, why don't we increase the intake of teenagers in terms of vitamin A to be able to handle this, especially due to the fact that adolescents usually get a bit of get acne a lot. Dietary fatty acids influence the inflammation, underlying the need to be careful in terms of dietary selection for optimal control when you are trying to treat patients. Linoleic acid and iodine have a role also in terms of pathogenesis of acne. Standard anti-acne therapy requires then that all dairy products and all glyceric foods should be stopped for at least 6 months to evaluate the effects, because we have kept on saying that diet does not affect. So that is something we can consider. I'm not a nutritionist, but those are the different foods that we should think of as we are able to handle patients. The main thing is, from what I have found, is can we be able to collaborate with the nutritionists when it comes to managing of acne. Now, this slide simply tries to explain to you why nutrition plays an important role in terms of pathogenesis of acne. Now, when we look at future treatments, we find that there are many drugs and they are going to target different places. When it comes to isotretinoin, I think Dr. Wanyika will be talking about that. The main thing is when you give isotretinoin, you give, it works, you stop, it starts causing problems. You can get it recurring again. So they are coming up with, and it has quite a number of side effects. So they are coming up with formulas which will last longer and will have the molecules which are going to be released into the body much smaller. There is retinoic metabolic blocking agents. These ones I will talk about. I think you'll see the slide of the new ones which are coming up in terms of being topical. There are those ones where now they are working on where the endopeptidases are being used as inhibitors so that you can be able to stop acne at a much lower level. There are the antibiotics. Now they're saying you should not only use one antibiotic on its own, you should use it combined with one of the retinoids. There is androgens. Remember, there is spironolactone, which they are using, but they are using it as a form. Insulin sensitive agents, we are talking of metformin. So all these are coming up because now we can be able to manage acne in different ways, but when you have so many drugs for a condition, it means you do not know where to hit. And do not forget diet per se. This is simply a diagram to be able to demonstrate the different areas in which you can be able to handle acne. And this tells you more of how difficult it is currently. The other drugs which are there are those ones which I think people will be able to talk about them, but they're the newer ones. There is sarecycline, which is now taking over from tetracycline. The others are mainly those ones which are related to the isotretinoin in terms of being topical. So there are very many new drugs which are coming up which can be used. Now, in conclusion, we have to think and know that sebum glands are not simply cutaneous appendages supplying sebum to retain the humidity in the epidermis, but also serve as an important stage for immunological phenomena, synthesis of antimicrobial peptides, and expression of the stem cell characteristics. The main acne treatment challenges in the future will be, one, rebalancing the natural microbiome of the skin by restoring the natural skin barriers in targeting cytokine receptors. Two, limiting the proliferation of, it's supposed to be C. acnes on the skin using the topical antimicrobials, which do not cause resistance. And three, regulating the sebum overproduction, sebum outflow and composition. Thank you, and those are my references.